Okay, good morning, good afternoon, and good evening to all. Thank you for joining. My name is Robert Martin. I'm a scientist at the Alliance for Health Policy and Systems Research. Welcome to the webinar on co-producing knowledge for stronger health systems. Before we get started today, some quick housekeeping points. Next slide, please. Next slide, please. Yep. If you have a question for any of the panelists, please use the question and answer button. And we really hope you do. Like to encourage everyone to ask questions. So feel free to type them into the Q&A chat. This session will be recorded and made available online after the webinar finishes. And now we have a fantastic lineup and discussion prepared today to launch this BMJ collection on co-production. We're going to start with some words from the BMJ editor-in-chief, Kamran Abbasi. I'm then going to moderate a brief discussion with some of the authors from the collection. I'll ask each of the authors one question to get things going. We'll use the remaining time for discussion with questions and input from you in the audience. And at the end, we will have closing remarks from the Executive Director of the Alliance for Health Policy and Systems Research, Abdul Ghaffar. For now, before we move to the panel, I'd like to start by asking Kamran to give his opening remarks. Kamran, over to you.
Yes, Robert, thank you very much. Hello and good afternoon, good morning, good evening, wherever you are. So I'm Kamran Abbasi, I'm executive editor with BMJ. Just to clarify, I'm not editor-in-chief, Fiona Godley is the editor-in-chief. I haven't had a promotion in the last 10 minutes, but we work very closely together and we're all delighted to be supporting this collection on co-production of knowledge, which is very dear to our hearts. I mean, the BMJ has been involved in patient partnership in co-production for over 20 years. And a lot of that was down to the efforts of one of my colleagues, Tessa Richards, who I hope is on the webinar today. And over that 20 years, we have moved from patient partnership to co-production, and we do try our best to live and breathe it. We have a patient editor, we have several patient editors. We have 3 patient editors on our team, apart from Tessa. We have a patient panel, Simon Denegri, who's on the steering committee for this collection of papers, is also on our patient panel. And we have those patient editors working in each of our sections to try and help us produce articles that are co-produced. We do that to varying success. I mean, we admit openly that although we may be ahead of many other journals in terms of our patient partnership work, in terms of our co-production, possibly all journals, it's still been hard work. And that's one of the lessons that we've learned, is that it's hard, co-production. It requires commitment, it requires resources. You don't always succeed, but you need to have the collective will and the belief in the process. This is a better way of doing things. And that leadership and that commitment needs to come right from the top. And it's good to see that this collection of articles reflects that. It also reflects the importance of research, of evidence, things that are very dear and close to our heart at the BMJ. So I'm delighted that we've been able to work on this collection. It's an impressive piece of work. There are 13 hard-hitting major articles, and what's so good about them is that they very much reflect what's happening around the world, and especially the voice from low and middle income countries. We have examples from Thailand, from Ghana, Cambodia, Kenya, South Africa. It's a truly global collection. And that's where the true impact of this work, I believe, can be felt. If you read the collection, you'll also learn a lot. You'll learn a lot about why this is important, how we can achieve co-production of knowledge. You'll also come away with 1 or 2 snippets for future talks and presentations. I was fascinated by the term collective sense-making. We may hear more about that in a minute. You'll learn about the triangle that moves a mountain. Some of you may know that phrase already. And most alarmingly, I think you'll discover that only 2% of the co-produced production literature examines low and middle income countries. And that's something we need to correct. And I hope this collection can be a platform for that. So to achieve co-production, I take this from a wonderful editorial, lead editorial by many of the panelists and also from the steering committee. You require context, the setting. You require trust and power sharing. I think these sentiments are very, very important. We require practical skills and upskilling of researchers and communities and institutions and organizations. And we need new approaches to research funding. And I'm sure all these issues resonate with us as we've looked on and helped tackle and commentate on the challenges that COVID-19 has faced us with. So I wish you a really enjoyable experience engaging with this collection and listening to all our panelists in the next half an hour. I want to leave you with a quote from a piece by Robert and Ghaffar and others. And it says that co-production exists in pockets of good practice and in piecemeal projects. But the vision of a research ecosystem with co-production at its center remains aspirational. It is difficult to envisage what such a system might look like. While the challenge of unequal power dynamics between stakeholders may be resolved at a local level, what does this mean for national and international research communities and health systems? What structures, institutions, and cultural changes can the WHO, the Alliance for Health Policy and Systems Research, and others support to create co-produced research to improve health systems? And I think that's the challenge, that's the platform, that's the starting point. And I hope we can really accelerate, catalyze, and energize this conversation because it's so important for the health of populations. Before I finish, I want to thank Ghaffar and Robert for working with us on this and bringing this work to us. I also want to thank people on my team, Tessa Richards, who helped a lot with the conception of this project, and then Kat Chatfield and Rachel Hinton, who then executed it on behalf of the BMJ. So thank you. We're right behind you. We're living and breathing it. It's hard, but let's stay committed and we'll get there. Thank you very much.
Thank you very much indeed, Kamran. Thank you also for that inspiring challenge. I think we have a fantastic lineup of authors from the collection with us today to begin to unpack some of those questions. We have Irene Agyapong from the Research and Development Division with the Ghana Health Service. We have Kumanan Rasanathan, most recently with WHO Cambodia. We have Lucy Gilson from the University of Cape Town. We have Srinath Reddy from the Public Health Foundation of India. And finally, we have Sally Redmond from the Sachs Institute. So really pleased to have some of the authors with us today to discuss these questions. I'm gonna ask each of the authors one question. I'm gonna ask each of them to respond for about 3 to 4 minutes. After this first round of questions, we will open it up for discussion. So again, I'd like to remind all of the attendees, all the participants, please put your questions into the chat. We look forward to receiving your questions. We want to engage with you and really make this a discussion. So coming to the first question, Irene, thank you again for your paper on strengthening capacities and resource allocation for co-production of health and LMICs. Congratulations. The first question for you, in another piece in the collection, David Baran, Maria Amalia Pesantes, and colleagues argue that we need to rethink research processes and adapt training and funding processes to facilitate co-production. Do you agree? What can we do to establish and institutionalize a culture of co-production? And why is this so important for health systems research? Over to you, Irene.
Thank you, Robert, and it's my pleasure to be part of this panel. Yes, I would definitely agree with them, and I think in terms of what can we do, I would cluster it a bit into 5 pieces. The first one is advocacy, the need to keep emphasizing the value and also demonstrating the value of co-production. There's a cartoon originally used in project management in the 70s that I find it's very useful as a light way of helping people to appreciate the fact that in trying to design something, if you just use one mind, you may not get exactly what you want, because the project sponsors are thinking one way, the project requests, the analysts, the users, the programmers, and so on. And it's the same with co-producing and with designing an intervention that works in context. Even if it's proven to work in another context, you really need to bring together the different thinking to end up with what users really need and will work in this context. So that's the advocacy and kind of repeating the message over and over again. Then there's the funding, because it does take some resources. And as has been said earlier, especially in low and middle income countries, this is not a classic funding priority. And then I would also talk about the incentives, because researchers need incentives to go down particular routes. If you spend a lot of time co-producing an intervention that works wonderfully in context, as an academic researcher, you can't publish it, you can't get credit for it. The next academic researcher may not be so interested. And then I would also talk about capacity, building the capacity to do this kind of work. And finally, being ready to be in there for the long rather than the short term. So so I would say, yes, I agree. I think it's hugely important. And these are some of the things we need to do to make it happen. Thank you.
Irene, fantastic. Thank you. Advocacy, funding, incentives. I think these are all great points. Thank you. Koumenen, now on to you, and thank you for your piece on building a collaborative research culture for multi-sectoral policy and implementation in Cambodia. We have another paper in this collection from Thailand, where Viroj, Waliporn, and colleagues share how co-production and improved research capacity coupled with citizen engagement have contributed to developing health policy there. In the paper of you and your colleagues looking at Cambodia, you particularly consider opportunities for multi-sectoral co-production. What and where are the opportunities to advance a multi-sectoral co-production approach? Why is this important, and what lessons might this have for other countries? Over to you, Koumenen.
Thanks, Robert, and good morning, good afternoon, good evening, everyone. It's a great pleasure to be on this panel, and thanks to the Alliance and to the BMJ for convening and inviting us to participate. I think, firstly, I mean, the theory of the triangle that moves the mountain, which people are familiar with in Thailand, where it's really saying, you need policymakers, you need researchers, you need people, you need communities to sort of foster change and to solve complex challenges. And I think we all agree with that. And that this concept of co-production, it can seem abstract, I think, to a lot of people, but really is saying, as Irene has said, you need different perspectives to really solve problems. And in that, co-production is not an end in itself, but you also have to allow that research is not an end in itself. I think really what we're talking here, and certainly in our paper, is how do you meaningfully allow people to sort of drive improvement in their health and in their well-being. I suppose we would say more framework-wise achieve SDG 3. I think in Cambodia there are a lot of opportunities, and here we've really focused on co-production between thematic sectors, health with other sectors, which we often talk a lot about, but often the health sector we're not always that good at. And there are opportunities in rapid socio and economic development. There's the opportunity of the SDG framework. There's the opportunity of rapidly maturing research institutions. So, and there's an opportunity already of sort of multi-sectoral frameworks for particular problems like non-communicable diseases and antimicrobial resistance. So there are a lot of opportunities, but I think we need to step back and firstly say, in a country like Cambodia, my colleagues my co-authors, in a way, co-production comes intrinsically to them because they have a foot. Yes, they're researchers, but they're also very involved in policymaking. So perhaps in some other settings and high-income settings, it might be more siloed. in a country like Cambodia, there's already sort of actors and facilitators for co-production. And which I think really brings us to what I'd like to say is that if we really want to see co-production across thematic sectors, across stakeholders, with communities, with patients, it really does, as you would like to say, comes to issues of power, to really interrogating whose incentives, whose institutions are prioritized, which frameworks. And there, I think, if I can say, sort of as a marginal researcher, it does involve researchers and academics being willing to surrender power in the stewardship of research. It involves journals thinking differently and really engaging with the realities, the time demands, the incentives of people here. We've talked about the sort of how low and middle income countries aren't sufficiently engaged in this. And so I think it's really a question of, are we willing to sort of take on those different perspectives? Are researchers willing to do so? Are journals willing to do so? And if that can happen meaningfully, if power can be shared, then you can benefit from these varied perspectives, particularly of communities, to then together develop solutions to problems that make a meaningful difference to people's lives. And that needs to be the metric, not impact factors, not publications. Now, the question is, if I can be provocative again, are researchers prepared to do that? Are high-income institutions, are journals like the BMJ really willing to go there? And I think we've heard from Kamran they are, but it's a work in progress, as we all know, and certainly our experience, including with the Alliance on Embedded Implementation Research, academics aren't always so keen to do that, and I'm sure others will talk about that. But I think that's really the challenge we need to tackle, and hopefully this collection will assist in that task.
Thank you so much, Kumaran. Really, really insightful questions. Are we willing to share power? Are researchers willing to share power? Are journals willing to share power? Are policymakers willing and able to share? Really thought-provoking questions. Thank you. Next up, we have Lucy. Lucy, thank you for your piece on collective sense-making for action. Researchers and decision-makers working collaboratively to strengthen health systems. In the collection, we also have a piece from Eva Turk, Anna Durrance-Bagale, and other colleagues in which they argue that for far too long, health research and the development of health policies and interventions have been done to and not with communities and individuals. They remind us that power dynamics, again, between different groups create barriers. What do you think, Lucy? How can we reimagine the power dynamics of co-production? How can co-production improve health systems' decision-making space? Over to you, Lucy.
Thanks so much, Robert, and thanks again to the BMJ and the Alliance for facilitating this special issue and this particular webinar. I want also to thank my co-authors on the paper that is in the edition, and beyond the co-authors, all those in each country, South Africa and Kenya, who were involved in the experiences reported. And I want to answer your question by references to the particular experiences we have reported. And they included research, but went beyond research. The activities include an embedded researcher located within a government organization, and they include a regular journal club that brings together managers and researchers to share experience. And they are all activities that seek to support decision-making, which is also part of the center point of your question. And they seek to support decision-making by bringing together different voices, people with different experiences and different ideas. But they don't understand decision-making to be located in a single and formal decision-making space only, but in a sort of web of interconnected spaces where ideas are generated. So in these processes that we share our experience of, they all draw on formal research evidence, but more importantly, they draw on informal, tacit, experiential knowledge, and they allow that knowledge to be brought together with more formal research evidence. They're also not just about a passive sharing of knowledge, it's about an active engagement over knowledge, of a testing of ideas, of a critique of ideas, and a dialogue about those ideas. And there's a focus not just on knowledge sharing, but on the action that results from sharing knowledge. So in coming back to the point about power dynamics, I want to suggest there's two ways that co-production rebalances power dynamics. The first is in terms of who is involved. It's not just the researchers, and senior decision makers. In our experiences, it's a wider range of people, and other papers in the edition also talk about the important place and role of patient voice in these discussions, in co-production processes. And secondly, and critically, they rebalance power in terms of the knowledge that is valued, moving beyond only focusing on evidence produced by researchers to embrace, engage, and really actively draw on the experiential and the tacit knowledge of those within systems. But it's not just about rebalancing power, it's also critically about building trust. And in all of our co-production experiences as reported in the special issue, it's as important to build trust as to rebalance power. And you do that by the way you engage with each other. And it is that building of trust that supports the mutual learning and the collective sense making that is essential to action. So ultimately, co-production processes support decision-making by creating spaces where new ideas can be generated on the back of old ideas, but ideas that are owned and acted on by those involved. Thanks so much, Robert.
Fantastic. Thank you, Lucy, for some very concrete ideas about how we can rebalance power, thinking about who is involved, the knowledge that is valued, how we can create and facilitate trust, and how we can innovate ideas and build on them. Really useful comments. Thank you. At this point, we're going to move to Srinath Reddy. Srinath, thank you so much for joining us. Congratulations on your piece on the ethical challenges of co-production. In another piece in this collection, Lance Skeeter, Marianne Stevens, Asha George, and colleagues also have a piece about co-producing research with sex workers in South Africa, in which they argue that co-production includes long-standing relationships of trust and care, something that we just heard about also from Lucy. In your piece, you summarize some of the ethical challenges of co-production. Could you give us an example of some of these challenges and tell us how we might think about them and why they're important? Why do we need to grapple with these ethical challenges? Thank you, Srinath. Over to you.
Thank you, Robert. Well, when we are dealing particularly with health systems research, and when we are trying to engage policymakers and decision makers, health system managers, frontline health workers, and the researchers, we have to really deal with several divergent perspectives, power asymmetries, and sometimes prior prejudices that are brought into the room. And how do we actually deal with them, not merely to ensure that there is a robust research design, which is as free from biases as possible, but also to ensure that the ethical dimensions of research, both in terms of conducting the research as well as ensuring the appropriate distribution of the benefits of research, are attended to. For example, if you're really looking at the design and conduct of the study, for example, we had a study conducted on looking at how frontline health workers in urban communities, slums of Delhi, how their ability to deal with maternal and child health and enhance their efficiencies by improving processes and ultimately reflect on outcomes. That whole project involved people right from the health system managers to the frontline health workers. There, the question, even in terms of designing the conduct of the study, the issue of why we would have a control community comes into play, because the idea of having a control community would seem unethical to them. And the explanation, for example, of how a delayed intervention in the control community can actually be good for the understanding of the impact of the intervention itself, rather than a before and after type of comparison, that requires an explanation. Therefore, getting the people participating in the process to understand the ethics of some of these, which of course, the whole ethics of a control group are always questioned, even in the academia. But when you're dealing with people, whether they're health system managers or whether they are the frontline health workers, it gets a little more complex process. But we have to be very sure that we are on firm ground. And particularly when we are dealing with power asymmetries, the role definition of who is contributing to the research design and whose perspectives are dominating it also becomes very important. The frontline health workers bring in the community's perspectives because they internalize it, they experience it, whereas the health system managers are bringing in different perspectives, and we should not allow the power asymmetries to unsettle the research question in a manner that it is unfair to the community's voices. But when it comes to sharing of findings, then you find that there is a common concern both among the health system managers as well as the frontline health workers as to how widely the findings would be disseminated, A, within the community, and B, within the media as well as elsewhere, because the possible censure or penalties of underperformance may be visited upon the people who are both managing the program as well as the people who are delivering the program at the front lines. That is a natural apprehension. So any flaws that are there in the actual program itself, which are uncovered by the research, are they open for publication, or are they to be hidden behind closed doors for correctional disclosure, which they welcome, but not necessarily having them displayed out in the open? So the ethics of that also have to be looked at by the researchers, because one of the things that we need to do is not to cause harm to the people who are also co-producing the research along with us. Then comes the issue of data ownership, particularly who owns the data when you are actually conducting research in tribal communities, for example, on tribal nutritional patterns, on conventional wisdom of the tribal communities, the experiential wisdom. So when the findings are actually then going into the publication mode, how much of that wisdom should be protected as the intellectual property of the tribal community itself, rather than be usurped by the researchers or others who are co-producing the knowledge? So all of these are interesting questions that we must consider in terms of ethics of co-production of knowledge in a variety of circumstances. But ultimately, the test of co-production is the benefit to the community that is being engaged in the whole process.
Excellent. Thank you very much, Srinath, for those insights and thinking about, again, sharing whose perspective, different power asymmetries, data ownership, experiential learning, how we grapple with all of these issues. Really, really important. Thank you. Finally, we are now going to move to Sally. Sally, thank you again for your summary piece on the future of co-production. Also, as part of this collection, Chris Hatim and Ama Pukwafeni have a piece on how Ghana is using production approach to strengthen Ghana's national health insurance scheme. How can we make sure this sort of thing happens in more countries? What is the future of co-production, Sally? Over to you.
Thanks, Robert. And I guess I just wanted to start by saying that it's been a real privilege to be part of this special issue and to see the quality and the exciting range of papers that are included in the issue. So I wanted to thank you and your team and the BMJ for putting this together and recognising the value of the collection at this particular point in time. So I guess I would start really by sort of saying that I think, you know, obviously when you look at the collection, despite the fact that we've seen that only 2% of papers about co-production come from low and middle income countries. Nonetheless, there's obviously a real diversity and activity in thinking about co-production, and lots of different things being tried. So it made, I think, the issue incredibly interesting. And I think I would say really I'd want to make 2 points which, you know, kind of build on really what other people have already said. So the first of them, I think, is to say that the papers on this issue really illustrate the importance of context. So this has been mentioned already, but I think that part of what the future holds for co-production is a better and more detailed understanding of what co-production is in different contexts, recognizing that it's going to be really different, what the conditions are that support it, when it works, what kind of issues does it work for best, what are the precursors of co-production, what kind of conditions do we need to make it work? Is it the same when we talk about co-production with patients or communities, or different when we're talking about policy agencies or senior policymakers? So I would say that over the coming 5 years or so, we're going to see a wealth of understanding. And while we talk today about co-production, I suspect we're going to find that that idea has some common components, but grows very many different sorts of faces as we kind of move through learning about this. So we should welcome that, I think, and we should not miss any attempt to try and build in some kind of description, evaluation, examination of what happened and what the impact of it was. So I think that's a challenge to all of us who are doing this work to sort of understand, to use it to build the knowledge base of how we work in co-production. I think the second thing I would say is that despite sort of the importance of context in determining the way we work, I think there are some common things, and several people today have already talked about the central role of trust. So at the Sachs Institute, which, you know, is a kind of boundary spanning organisation, we work with both senior policymakers and with Indigenous communities in terms of co-production models. So, you know, there are different things that are important for those different kinds of partners. You know, one of them is obviously the power balance, and that is something that's really important to consider. But for all of those relationships, trust lies at the heart of it, I think. So, you know, one of the really important things around building co-production is thinking about how we build strong and trusting working relationships between researchers and the people that they're working with on co-production activities. And people have already suggested quite a number of ways that can happen. You know, I love the triangle because it just illustrates so nicely that kind of concept of all working together for a common aim. And obviously having a shared agenda is a really important component of trust. I think I also really liked Irene's cartoon that she put up about, you know, showing how people can interpret the same thing in a different way. And one of the things that we find a lot is that people that we work with, we're sometimes using the same words but meaning something entirely different. So I think we're learning a lot about how to be careful around language, how to document, how to not raise unrealistic expectations on either side, and how to deliver on the things that you promise. We've done quite a bit of work with knowledge brokers, and we find having somebody who's familiar with both worlds, being able to clarify that communication has been a really useful tool. But I think perhaps the most important thing is to think about long-term partnerships. The idea that you can do a co-production project, you know, you can set it up quickly and move on is just not the way this kind of thing works, because trust really established is something that has to happen over a long period of time. So somebody a bit earlier on talked about the need for changes to funding, and I would really strongly support that, because in most countries, I think our funding supports short-term projects, and investment in long-term partnerships would be a much more valuable way of supporting co-production. Robert, thanks for the chance to be part of this today, and thanks for the opportunity to talk.
Okay, perfect. Sally, thank you so much for your insights. Again, the importance of context, of trust, of language, and making sure that we're all using and understanding words and concepts in the same way. At this point, I'd like to move to a kind of a round robin discussion. We've got a lot of great comments in the chat. We have some questions. I saw one important comment that I wanted to highlight from Sassi Molyneux. Really interesting and important insights on the ethics. There's some thoughts on justice considerations and ethics of HPSR in a paper, and she shared a link. Co-production has done well with great potential to transform injustice. I think that's an important point. Thank you so much for raising that. In the questions, we have a question from Gary Hickey, who says, I agree with Lucy that building trust is so important, but how do we get research funders to not just acknowledge this, but ensure that it is reflected in research funding? I think this is a really important point. And I think, Sally, you touched upon this. Lucy, I wonder if we could come to you and ask you if you have any thoughts on this. How do we ensure, how do we get research funders not just acknowledge this, but really ensure that it's reflected in their funding? Any thoughts from you?
Thanks, Robert. Well, I think the long-term nature of relationship building to build trust to enable co-production is really important. So one of the things that funders need to think about is the duration of their funding. And in the work that we did, we were assisted by a longer period of funding. That's one thing. I think another thing is, what is valued by the funders in terms of how they assess research processes. And there, it's got to go beyond papers. It's got to be about, and it also shouldn't only be about, have you influenced a policy document? It's got to be about something more active than that in terms of the relationships that are being built and the types of changes in practice that they might be able to support. Thanks, Robert.
Thank you, Lucy. Really important points. Another question we have here, Claire says, co-production journals needing to think differently about publication when it comes to co-produced research. What are some specific examples of how journals can share power? Kumanan, do you have any thoughts on this? Any ideas on how journals can share power and think differently?
Yeah, thanks, Robert. I thought I tried to get through my intervention without mentioning COVID, but I actually would be remiss not to say that anybody like me and my colleagues who wrote the paper who've been involved in sort of national responses to COVID, especially in the first few months of last year, were involved in a very sort of co-productive process, right? And I think there it's interesting then to see the roles that journals have played around COVID. I actually think, for what we're talking about, multisectoral, but COVID is a great opportunity. You've got this sort of all of society attention to the creation of health and the destruction of health. We've really seen that we've had to be innovative and share knowledge in different ways. And it's been this iterative process where we've, the first few months in Cambodia, we were just listening to whoever was having experiences. We were getting knowledge and information from wherever we could, right? And then coming up with attempts at solutions and then iterating and getting feedback on those solutions. So I just wanted to make that point. I think journals also, what's happened with journals around COVID, we've seen sort of innovative attempts to foster the sharing of knowledge. But I think what we've also seen is the limitations of journals, right? And that journals are not the be all and end all in terms of sharing knowledge and research. And I think, journals like the BMJ, I think they embrace that, right? I mean, the Facebook groups, the WhatsApp groups, the way we were sharing information among clinicians in last January, February, March. So I think that journals then need to consider, because one of the risks is that when you say co-production is important, it just becomes a tick box, right? That the researcher goes and ticks the box about co-production, and we've got these groups. But it comes back to how do we really share that power? It's Lucy's point, how do we value tacit knowledge, different types of knowledge? And I think this is the challenge, given journals, publishing models, business models, the way journals have prestige, how do they measure things differently? How do they value, how do they address those, that gap in terms of representation and genuine driving the agenda from low and middle income countries? So I think that some of the things that BMJ is doing is very positive. And look at this collection. You've heard from Kamran their commitment, other journals as well. But I think everyone would admit there's a long way to go. And it really sort of, in the rethinking of the publishing model, the business model of journals, thinking about who's valued, who's involved, who has power. There's still a long way to go.
Perfect. Thank you very much, Kamran. And I also note a comment here from Tessa Richards. Should more health journals adopt the policies adopted by the BM Quest authors to include a statement how and involve patients, communities, civil society groups in their work and publish this statement in an accepted paper? So really important issues around journals there. Thank you. I noticed also another comment in the chat. How do we together as an international research community to change research culture and practice rather than working in our communities or our countries, often isolated from what others are doing? This is from Sofia Stanisveska from the Warwick Medical School. Irene, I wonder if we could ask you about that. How do we really change the research culture and practice rather than just working with the same people, the same partners that we usually work with? Do you have any advice, any insights on that?
Yeah. Thank you, Robert. I think the first thing I'll say is that changing cultures takes time. And I think several speakers have already talked about the fact that if you want co-production to increase, we need to be in there for the long haul. So I would say the first thing is to recognize you can't instant change culture. It's going to take time. Then the second thing is that you kind of need incentives for people to want their cultures to change, because cultures are ways of doing things which have become established. If the incentives are not to co-produce, it doesn't matter how much you talk, they will not co-produce. And then there's also the issues of, in building that kind of culture, recognizing that actually it's a culture where Lucy talked a lot about trust. I think one other speaker talked about sharing power. It's a culture where relationship building matters and where the skills are more social skills, you know, being able to share relationships, being able to build trust, being able to work with people over the long term in respectful partnerships, recognize that there is not an absolute hierarchy of knowledge. Sometimes I use this in a way to help people kind of grasp it, that I may be a professor in survival, and I've never lived in a jungle. If you throw me into a jungle, my survival is not going to depend on all the papers I've written. It's going to depend on the people who live day to day in that jungle. And that's a bit what co-production is about, recognizing that value of knowledge depends on context. Yeah, maybe I should stop here.
No, thank you. Thank you so much, Irene. Really, really helpful metaphor again for understanding the value and importance of co-production. Another question from Ayrton. In your co-production experience, how do you deal in a community in which you have a very polarized political situation and a lot of misinformation, which can be very common in the social media? Srinath, I wonder if we could ask you how to deal with that. How do you deal with a community in a very polarized political situation where there's a lot of misinformation? Can you give us some insights on that?
Clearly, there are different interests who are actually pushing the misinformation. The ability of those vested interests to gain ground will be greatly diminished if we are transparent right from the very beginning in sharing information. You do not leave fertile ground for misinformation to spread if you have already occupied that ground and the mind space with regular sharing of right information. At the same time, if you have the community's trust with constant engagement with them, and you are seen as the trusted messenger, they're more likely to take your version as the fact rather than depend upon falsehoods that are being disseminated by others. Obviously, there are going to be different political, ideological, and social interest groups who will be pushing misinformation. And we have to try and bring the best of science in order to counter it. But the critical element is A, constantly share the information with the communities. B, build partnerships, because it's absolutely important that it's not merely a top-down approach of messaging the right information, but ensuring that there is a community connect with groups who have the confidence of the community in terms of their trusted voices, who understand the message and can disseminate it through their own community networks. The wider the sharing of this information, the better it is. And that is how we counter the misinformation overall.
Perfect. Thank you very much, Srinath, for that guidance. That's very useful. I see another question here from Andriada Vinachuk. Co-production is a spectrum in terms of levels and types of involvement and ways in which and the extent to which power is shared. To be meaningful and not tokenistic, it also requires time, which is not always possible due to strict research timelines, funding cycles. How can we convey the importance of this to funders and overcome this barrier? Sally, I wonder if we could turn to you. I think you touched upon this in your piece as well, and wondered if you have any insights or advice on how we can try to move beyond tokenism, how we can make co-production meaningful, given the constraints that we all face. Over to you, Sally.
I think the two biggest challenges, I think, are recognizing that the need for long-term investment, and also recognizing the need that co-production is a more costly way of doing research, because all of the things that we've discussed, what's for me this evening is have sort of related to the need to build relationships, and that takes time and energy and resources. So and by and large, I think this is quite challenging for funding agencies, but I'd give a couple of examples. So I think, I apologise, they're both Australian examples, but I'm sure people will be able to think of ones in their own countries or other places. But our national funding agency has had for a while a scheme called a partnership scheme. Partnerships, the particularly important has been their partnership centres, in which they've invested for quite a lot of money over 5 years. But importantly, the funding agency, have built relationships with a series of government partners, so that who have also invested. So in a sense, there's a funding pool where the end users have also invested funds along with a national funding agency. And that's been fantastic in terms of just really, people wanting to get their money, so wanting to be therefore really engaged in the co-production process. I think a second example, comes out of our state government, where it's had a very obvious approach to funding the kind of research that it wants to see done, and funding it in a way that it determines it should be done. So, for example, it makes the local health authorities the fund holder, and I know lots of other places overseas do this as well, and it requires that fund holder, the local health authority, to commit to ongoing delivery of the program if it proves to be effective. So it's really, there's a lot of those interesting models out there at the moment, and I think that it would be a really valuable piece of work to collect those things along with where they seem to be working, and try and sort of promote them as examples of best practice. Thanks, Robert.
Yeah, no, thank you. Very, very helpful, Sally. We're starting to run out of time, but maybe one more question. This is from Dirk Muller. I have a question to Lucy Gilson, who quite rightly pointed out that we now need more than just evidence of policy, but if I understand right, something more around how practices have changed. Lucy, do you have examples of good practice, good indicators that could be used?
So I'm not sure it's about indicators. I think it's a process of assessment that tracks change over time and that engages those involved in the co-production process so that they can report on the consequences of co-production, the ways in which co-production has fed into their own activities and into their own practices. So I don't think indicators necessarily pick up the types of changes that are possible, and in fact can miss really important things. To give one example, the ways in which researchers who are educators involved in co-production activities can feed the co-production insights back into their training activities, which then spread it out further into a wider community. So you almost have to be looking for the unintended consequences rather than using indicators to track intended consequences. Thank you.
Thank you very much, Lucy. Really, really helpful. Another comment here, Louise South Island. Thanks for these interesting presentations. I particularly appreciated Kumanen's discussion about multi-sectoral co-production. My question is whether this has included co-production with people working in, living with, experiencing the criminal justice sector, in particular, given the critical role justice involvement plays in relation to access to health and health outcomes. Kumanen, I wondered if you had any thoughts on this about examples of working, maybe not just with people in criminal justice, but within other sectors, any examples that maybe you wanted to highlight?
So I think, you know, looking at people who are in criminal justice settings really highlights the issue of equity. Often prison populations are some of the most marginalized people that we have. And, you know, I actually think, again, there's many examples from COVID about looking at prison populations who've really borne the brunt often of COVID and look, you know, differential success in terms of countries, and we did some work in Cambodia as well, thinking how to better work with, you know, those populations and better protect their interests. But I think that the broader thing that it goes back to your previous question is that when you sort of, particularly with, you know, so-called marginalized populations, is we talk about the time that co-production takes and getting funders involved. But I think we really have to highlight the time involved for people who engage with co-production and don't have such conventional interests as researchers, so policymakers, communities, right? And that however we assess these impacts, and it's particularly for sort of, you know, marginalized groups, if they don't perceive benefits, however defined, from participating, from co-producing knowledge, then there's real cost to people in terms of time, in terms of money. There potentially can be risks in being involved, but also it sort of deters people from then participating or co-producing knowledge in the future. Right. And so I do think there are a number of examples when we look at sort of multi-sectoral work where I can think of a lot of examples from sort of where Indigenous peoples have driven work from across different sectors. Often groups don't think of themselves in thematic sectors, they think of their problems. And so I think there are a lot of examples from around the world. The challenge is that, you know, how do we systematize the approach that really does, you know, recognize that people who have great challenges need to be in driving and, you know, what is needed. And then also adjudicating, does this process lead to a positive impact rather than indicators being exposed from without by funders, by others, by institutions. And I think that is the central challenge that we need to address if we really want to pursue equity through co-production.
Thank you so much, Kumanen, for those equity and the importance of thinking not only of the opportunities of co-production, but really, really helpful. Srinath, I think you raised your hand there. Was that correct? Would you like to add something on this?
Yes, basically, when we are looking at multiple sectors being involved in the co-production of knowledge, and even setting the research questions and interpreting them, there can be perspective differences. For example, in the case of COVID itself, when we take public health measures for containment of COVID transmission, the argument comes up of lives versus livelihoods. And loss of livelihoods itself can impact upon health. Therefore, the economic arguments against a prolonged containment process, which can adversely affect jobs, and the imperative of public health of protecting lives in the first instance by preventing transmission and severe disease. There can be conflicts in perspectives, not only in the policy setting, but also in interpreting the results of whatever health and economic evaluation you are doing. How do you project the results? So there can be considerable amount of differences depending upon which perspective you're reflecting in a multi-sectoral collaborative project. So all of those will have to be really ironed out during the process.
Thank you so much for those insights, Srinath. Guys, now we are running short of time. I think this has been a fabulous discussion. Thank you again to the participants. Thank you to the panelists. At this point, I'd like to hand it over to the Executive Director of the Alliance for Health Policy and Systems Research, Dr. Abdul, who will be able to give us some closing remarks, some closing thoughts on this important collection. Ghaffar, over to you.
Robert, thank you, but I see Kamran's hand up. So is there something important, Kamran, you want to say before I convey my words?
Yes, can I just make one quick comment following that really fascinating conversation? So I'll try, where's my video? There we go. Okay, so a lot has been said about journals and power. Can I just make a very quick comment on that, which is, I mean, journals have a lot of power in changing the discourse, in championing, in leadership, helping shape the research culture. We must take that responsibility, and the BMJ certainly does. I wish other journals would follow us in that. But we have limited power in effecting that change. And a lot of that power rests with the research funders, and they can certainly mandate co-production, and researchers themselves must act as well. So there's a very interesting and established power dynamic that needs to change. I just want to leave you with a quote that I was reminded of recently, which was from Aneurin Bevan, the founder of the National Health Service. And he said, the purpose of power is to give it away. So I'll leave you with that, and over to you, Ghaffar.
So thank you very much, Kamran, and thank you, everybody. The time is in fact up, so but I will just like to convey a few thanks, but few comments before I close. And I think one of the main things which came up was the discussion about power and the trust. And the one point I want to highlight, it is not only funders who has to fund, but it's also, I think, the research community. Within the research community, I can give you one example. There are people who genuinely believe in the knowledge translation, and that's fine. However, the issue of, there's a subtle difference between co-production of knowledge and the knowledge translation, because in the knowledge translation, still power is primarily with the researchers, and they don't want to lose it. And that is, I think, makes sense if it is in the biomedical research, but in the health policy and system research, we should promote more and more co-production of knowledge. Having made these comments, I think like I have been very happy to see our members of the board, STRAC, former members of the STRAC, and some other colleagues we have been working over the years, not only in the co-production of knowledge, but overall building the field of health policy and system research. So I was very impressed with the presence, and we started working on this area in 2012 when we were asked to write the WHO strategy on health policy and systems research. And the first recommendation was embedding health policy and systems research into programs and policies. And since then, our STRAC primarily, and Irene was chair and Lucy was the member at that time, have been encouraging us, helping us to test more and more how can we have a co-production of knowledge. And we were very happy to collaborate with the BMJ, because BMJ has taken like a leadership in co-producing of knowledge, but most of their work and most of the research of the knowledge generated in the co-production has been in the high income country, especially with the disease focus and with the involvement of the patients. So in this special issue, we wanted to take a leap and we wanted to advocate, test, and promote that there should be more and more knowledge co-produced with the help or with the engagement of policymakers and the researchers, and also more and more into the low and middle income country settings. And we are very happy with that effort. And I have, as you see, there are a lot of like good articles, good people, and none of them is a commission piece. These are all the people who has written these things, and they thought this is an important area of work, and this is an important work they have done, or they think it needs to be promoted. So we are very happy with that. And then I think I just want to have in the end, because the time is over, to convey a few thanks. First and foremost, thank you to all authors, panelists, and the participants. It has not happened without your input, your leadership, and your time. So thank you a lot. Second, to the BMJ team, especially Kamran, Kat, and Rachel. Without your help, involvement, guidance, and support, it would have not realized, and we have really enjoyed working with you all. So thank you. Last, but not the least, to my own team, especially Robert, who has spent a lot of weeks, days, hours to realize this thing over the months. But before that, I would just like to acknowledge that we have other colleagues who have been helping in this area of work, and we are very happy with that. And in the end, before I say again, thank you to everybody. This is just beginning. And as I said, it's a power. We need to make sure there more is more engagement of policymakers, decision makers, program managers, implementers, people, community, and the society at large, that whatever we produce, that knowledge is relevant to their needs. And it's not only sheer thinking of the academics and the researchers, or for that matter, even funders. So thank you very much. And we are looking forward to further build the field of health policy and systems research. Back to you, Robert.
Thank you very much, Gafar, for these very helpful words. I think this ends our webinar now. Thank you again for joining. All the best. Bye-bye.
Thank you.